Today we'll start with a twin block. In the last lecture, I had taken Frankel appliance. Okay, so the different names for the Frankel appliance, since it is given by Rolf Frankel, it is called as a Frankel appliance. It is also called as a Frankel regulator, a function regulator. Then it is also called as a gymnastic appliance as it exercises the muscle on the lip pads, on the buccal shield, on the lingual pad. So it is also called as a gymnastic appliance because its main mode of action is to increase the oral space and to screen away the deforming muscles and bring an equilibrium between the tongue and the circumoral musculature so that the mandible grows to its full potential. That is what is the philosophy of Frankel appliance. So 5 points in the philosophy I had taken. Then the difference between class 1, FR1, FR2, FR3 we had seen. So today we'll take up a twin block appliance. Now till now, all the functional appliances, right from activator, bionator, Frankel, it was a one-piece appliance type. Okay, where the patient had to place the appliance in the mouth. But no opening and closing movements were possible with that appliance. So every time for mastication, the patient had to remove the appliance. But in a twin block appliance, as can be seen over here, there are two separate blocks, upper appliance and the lower appliance. So that makes it comfortable to the patient. Patient can open the mouth, patient can close the mouth, patient can masticate, eat with the appliance. Patient has to eat with this appliance. So it is a two-piece appliance, more comfortable, more patient friendly. So it was Dr. William Clark who introduced this appliance. It is not on his name, the Clark appliance, but you should remember the twin block was given by Dr. William Clark. Now, it was developed by William Clark, who reported fitting the first twin block in 1977. And then later he introduced this appliance in 1982 in the British Journal of Orthodontics. So you have to publish your work. So once your work is published, it gets a recognition and then it is accepted by the community or by the orthodontic fraternity. So it was given where the central incisor was mobile, slightly subluxated, and there they wanted to give something like a splint also and an appliance which will correct a class 2. So it was given in 1977 where lower teeth trauma was not there since the posterior bite block to which an inclined plane is added. So the lower incisor trauma was not there to the central incisor. So a repair also took place of that central incisor. At the same time, class 2 malocclusion also got corrected. So it is a tooth and a tissue bone appliance. You anchor it. It has a clasp on the molar. So it is a tooth bone as well as a tissue bone appliance. The appliances are designed to link teeth together as anchor unit, to limit individual tooth movement and to maximize orthopedic response to treatment. So it has an upper posterior bite block. So all the teeth, right from the premolar, first molar, second molar, they are in one block. And you have a lower block, which is in the canine and the first premolar region. So one unit in the lower arch, one posterior unit in the upper arch, and it is an inclined plane between the upper and the lower block, which jumps the mandible forward. So we'll see the design of the appliance. So twin block appliances are simple bite blocks that are designed to wear full time. This appliance is to be worn full time. It is a full time appliance because it is comfortable. Patient can chew, eat, swallow with this appliance, do a lateral movements also with this appliance. So it is a full time wear appliance. Transmission of favorable occlusal forces to the posterior teeth through the inclined plane. So I'll show you that inclined plane. The forces of occlusion here used as a functional mechanism to correct malocclusion. Now, according to Dr. Clark, it is the occlusal forces or the masticatory forces directed distally on the mandible which holds the mandible in a distal occlusion or in a posterior position. So he has given importance to the occlusal forces. So according to him, it is the occlusal forces in a distal direction on the mandible which holds the mandible posteriorly. So this occlusal forces should be directed in a correct direction. They should be directed medially on the mandible and distally on the maxilla. So he makes use of here other workers, other masters of functional appliances. They had their own philosophy. Balter's given on the tongue, the Frankel on the circumoral muscles. So here his philosophy was it is the forces of occlusion which should be directed in a correct direction, that is in a class 1 direction. So the goal is to maximize growth response to functional mandibular protrusion by usage of a simple, comfortable, aesthetically acceptable appliance. So he is directing the occlusal forces in order to bring the mandible forward for functional mandibular protrusion. So, since he's making use of those occlusal forces, and occlusal forces, are more during mastication, when the person eats, when the person chews. So, he says this appliance should be worn during mastication, so that those maximum occlusal forces working will be directed in a protrusive position on the mandible and will correct the malocclusion, a class 2 malocclusion. So the purpose is to promote protrusiomandibular function and free the mandible from the locked distal portion. So he gives like a posterior bite plane. So no upper forces will be working on the lower forces, and he holds the mandible in a forward position. So all the forces which are working will be then in a protrusiomandibular function position. So they